Good morning, good afternoon, or good evening, and welcome back to Bariatrics and Beyond, the podcast where we talk about life before and beyond bariatric surgery. So grab yourself a drink and a healthy snack, hopefully sugar-free, so you don't get a cavity. But if you do, we have our dental coordinator on the podcast today, Vicky. How are you, Vicky?
How are you?
Good, good. So a lot of people probably don't know, but EOC also offer dental services, and you are the dental coordinator. So can you introduce yourself and tell us a little bit about you?
I'm Victoria, but I go by Vicky Mallozzi. I'm from Utica, New York. I've worked in dental prior to EOC for about 12 years, at the same dental office here in my home town, and I've been with EOC since the start.
Nice. What did you do at the dental office?
I actually was a coordinator up front too. I handled their insurance, scheduling. I was your person you talked to if there was any questions regarding financing. I did it all.
Nice. And so how did you transfer from, your hometown dentist to be like, oh, I'm going to just be a dental coordinator for a dentist in Mexico? How did that happen?
I was actually doing both at one point,
Oh,
but became a mom,
mm,
and it was easier to stay home when you have a little one, and that's how I just transitioned completely over.
nice. So that's really good. That's one really cool thing about EOC. It's like, you're not just a coordinator. For the weight loss coordinators, they've had the bariatric surgery. The plastic coordinators like Nicole, she's had a facelift. So, everyone's getting firsthand information down to even, you, the dental coordinator, you've got a, background in this. So you know what you're talking about. So that's awesome, Vicky. I really actually didn't know that. Like I thought you did, but I just wasn't sure and to what extent. Because I always
Yeah.
see you talking in the group about this, that, they need this. And I'm like, she knows the stuff about teeth, man. That's awesome. So, can you explain to us, for people that don't know about the dental services we offer, can you explain a little bit about the dental program and what kind of services does EOC offer?
We are a full dental office, so we do everything from your basic cleanings and fillings straight through to cosmetic dentistry with full mouth implants, all on fours, all on sixes. They do everything.
That's awesome. So, if someone, first off, can you explain? Because I've got crowns, right? But people always ask me, did you get veneers? And I think people just use the word veneers because they just think that that's like the smile makeup. But can you explain to people the difference between crowns and veneers and what one would you recommend?
So crowns versus veneers, a lot of times depend on a patient and their actual health of their teeth. If your teeth are more damaged and you've had like a lot of fillings through the years as a child or even as an adult, you're more likely going to qualify for crowns versus veneers. Veneers, when you have veneers, your teeth have to be in pretty outstanding shape to start with.
Mm,
They just goes down a little bit, and it's kind of has like a little lip, and it just attaches to the anterior, which is the front of your tooth. With a crown, they have to grind your teeth completely down, and that crown sits like a covering over the full tooth.
right, kind of
So again,
literally
it's
like a crown.
like a crown. It sets in there, and then they cement that to your little nub of a tooth that's left. Again, it also depends on what you're trying to achieve.
Mhm.
If you have your gaps in your teeth, if you have um, more, your teeth are longer or shorter, and you're trying to achieve a look, a crown is usually they're able to maneuver that a little bit more than the actual veneer. So a lot of times people say veneers and they end up having a crown.
Right. And way I got explained once before, like what a veneer is versus a crown. Someone said to me, it's like a veneer is almost like a press-on nail. You're kind of just
Yes.
putting a facade on the front of it, right? So with that being said,
Very different
right.
and a crown.
So do crowns last longer? Can veneers possibly pop off?
Yes, veneer. There is a chance that veneers can pop off.
Mhm.
They don't normally damage your teeth when they come up. But depending on what you're doing, especially anterior crowns, your front teeth, you're doing a lot of biting and chewing. There is a chance that it can come off. It is normal. It can be re-cemented. and there's usually no issues with that being re-cemented, but there is a chance. Lasting longer, again, same thing. Crowns tend to last a little bit longer, but that's because they're full coverage and they're
Mm,
cemented completely on around the whole tooth versus just the interior of the teeth.
that makes sense. And is there a thing called, like I could be making up the word, but is it like a composite bonding where they kind of is there another thing where they kinda just, like, bond over your teeth?
Yep, it's called a composite bonding.
There we go.
That's a bonding that's made of, like, materials that you would have, like, a filling. So
Mm,
some people that have problems with more maybe they like the way their teeth look, but the color of their teeth, or
mm,
maybe they need to change the shape of their teeth, then a composite bonding would definitely be something they can do. With composite bonding, they do not last a long time.
mhm,
You're looking at maybe 2 years with them, give or take. They do tend to stain quicker
mm.
because it's a material of filling, like a filling material. So it does stain, quicker, and you if it's something for a quick fix, then fine, but if you're looking for long term, I don't usually recommend the composite.
Gotcha. So if it's just like a temporary quick, like I've chipped a tooth, get that fixed before you can get a whatever you need done. So let's talk about price of the 3. I'm guessing the bonding is probably cheapest, and then does it go veneers and crowns?
Yes, absolutely. Actually, veneers and crowns are the same price.
Get out of
There's
town.
definitely same price.
Huh.
Um, for our best quality, which is a zirconia, which is the strongest material of porcelain that you can have.
Mhm.
They're 725. That's for our crowns and our veneers.
Wow.
Bonding, I bonding's like 190, $200 per tooth.
Okay.
But again, it's a short-term fix. So that's why it's always cheaper.
Nice, because I feel like everybody wants, like, it's kind of like the trend getting that Hollywood smile, even if you don't. I feel like the younger generation are doing it now. Even if you, like, don't need dental work, people are just going in to get those, like, perfect, straight, white, beautiful teeth.
Perfect for white teeth, it's the whiteness. That's what everybody's going for, that bright white.
Yeah.
But my suggestion is when you go in there, don't go in with just that attitude.
Mhm.
Like, "I want the whitest you can get," because then when people see the whitest from what they had prior, they're shocked and they don't necessarily love them. I
Right.
always say, "Go by the dentist." They
Mm.
do this every single day. They're
Mhm.
gonna show you a shade guide. They're gonna ask you what you're looking to achieve and what's gonna look best. They've been
Mhm.
doing this for years. Take their advice.
Right.
Don't just say, these teeth that are so white that they're gonna blind you, because chances are, in the long run, you might not love them.
That's true, and you know what I think this happens a lot with, like, plastic surgery and boobs and stuff like that. People go, "I want her size boobs," or, like, teeth, "I want her teeth," but it's like, guess what? Your face is different. Your smile is different. Her teeth in your mouth is gonna look different on your face, so always go by whatever the dentist suggests because
Absolutely. Everybody's mouth is shaped different, your
Mhm,
teeth are different. Some people have wider mouths, some have more narrow mouths.
mhm.
Some people are more tan, some are more pale. So you see
Yeah.
somebody who's extremely tan with white teeth, and honestly, that's all you see versus if you see who's, maybe a little bit more pale with it. So
Right,
I say, you don't have to, if that's really what you want, then you stick to it. But
right.
I always say, at least listen to the dentist and see what their suggestions are.
Right. So my sister, Nicole, she got the whitest of white, white, white. She's like, if I'm paying for straight white teeth, I want straight white teeth. And can I tell you the referral picture that idiot showed the dentist? Let me tell you what she did. She got a stick of gum, extra gum, like the white gum. She put it on top of her teeth and she smiled and she goes, "This is how I want my teeth to look." Straight white, and she got him. She loves him. Other people are like, "Wow, that's so bright," but, that's what she wanted.
And that's what it is. It's a preference. I mean,
Yeah,
if that's what you want and
yeah.
that's what you like, then obviously then
Mhm.
do it.
Right.
But I always say if you're not sure and you really don't know, then, go by let the dentist explain to you how this is gonna look or show you.
Yep.
They can show you the shade guide, like, this is what your teeth are now and this is what it's gonna look like. Are you
Mhm.
sure?
Yeah,
So
right. Exactly. And when I got mine done, I think I went like a shade or shade 2 a little not as white, and I wanted mine to look more natural because my teeth They were, my front 2 teeth were overlapped like that because I was like, "Can I just get the bonding done?" And they're like, "Nah, girl, like, your teeth are pretty they need to be filed down." I was like, "Alright, go sign me up for whatever." But I said, "I want my teeth to look like how they would if they were straight." So I always had bigger front teeth, and then I had, like, the longer, pointier side teeth, you know? So I was like, "Just
Yeah.
make them look what they would look like if I had braces for years." And then I wanted them white, but not like Nicole's white. And then when I did it, Nicole was like, "Oh my god, I actually really like yours." She's like, "I kind of wish I didn't get him as white now." And I was like, "No, I mean, that's what you wanted, it is what it is." But, I think for people out there who have had maybe insecurities with their teeth, you can always tell when people talk because this is what I used to do. I would talk and I'd talk like this. I would just hide my mouth, and when I talk, I'm a big smiler when I talk. And when I would watch stuff back, I'm like, "Oh, man, look at my teeth." And let me tell you, you guys, getting your teeth done is so liberating. Like, if it's something you've always been really self-conscious about, you just notice yourself just finding every reason to smile. It's like, "My teeth," you know? And I think,
And
like, for me, it was like my teeth and my arms were my 2 best investments in my body. I just
I think that you guys put so much time into your weight loss and your
Mhm.
plastics, you get your confidence back and you get the way you wanna look, and then maybe your teeth were put on the back because
Yeah.
of health reasons. People, some people have issues with them throughout their process, and they're always the last thing that, that people worry about. But I feel
Yeah.
like once you get achievement for your weight loss and your plastics, then come on and get a consult for your teeth if that's something that's also making you a little,
Heck yeah.
insecure.
Yeah, that was my reward when I lost 200 pounds. I was like, arms and teeth. Like, I didn't care about boobs at the time, but I was like, I need my arms and teeth done. So in saying that, what is the clientele? Are you getting companions coming? Are you getting past patients, or do people usually get dental work done the same time they're doing surgery?
So we get a mix of everything. What I'm seeing is a lot of people that come for their weight loss, a lot of their companions do the basic cleaning and whitening,
Mm,
just to start. And I think that's just because the whitening's a little bit cheaper than what you would do in the States, and it's just kind of a reward while you're out there. It's not a long procedure, it's not something that is so expensive that you have to plan for it, so I feel like that's why they use that service. But we do have a lot of patients who come for weight loss and plastics that are down there for their stay and will come and get a consultation and then return later,
oh,
like, within the next couple months once they've settled in.
that makes
Um
sense.
when you have weight loss surgery, you can do a lot of dental procedures.
Hmm.
You can do crowns, you can do a root canal, you could do fillings, you could do a cleaning. When you have plastics, you cannot,
Hmm.
unfortunately. So what I recommend is if somebody's coming for plastics and they're thinking they want dental down the road, get your consultation. You're down there a few days
Hmm.
earlier for your labs and your pre-ops. Get your dental consultation done while you're there so you have an
Yeah.
idea of what you're looking at for pricing and what you need.
Right, that makes sense. So why can't, plastics patients do it? Let's say they wanna get a cleaning or a whitening, they can't even do that before surgery?
So they are allowed to do whitening, they are not allowed to do a cleaning.
Mhm.
Most of the time it has to do with infection.
Ah,
Um, Cleaning, they're probing your gums. There's a chance that they can, they're underneath your gums.
mhm.
They got the in there. You're stirring up bacteria, and now you're going into surgery. So that's why they usually do not recommend doing a cleaning. They can do a whitening. Um, I always tell any type of patient, if it's a plastics patient, that they need to ask their coordinator and make sure that the doctor's okay with them having any type of dental.
Yeah, that makes total sense. So let's talk about, like, procedure time. So, obviously, like, the general stuff, like the fillings and the root canals and the cleanings, like, they're just like a one visit thing, right?
So root canals, if you're not doing a crown, a root canal can be finished in a 1 day thing. If
Okay.
you need a root canal and a crown, you're looking at least 2 to 3 days because
Mhm.
they have to make the crown. Um, that being said, it can be done in one trip while you're there.
Right.
Just the 1 day thing. Fillings, cleanings, whitening, a little bit of a bonding and extraction, that can all be completed in 1 day. But a root canal, If it needs a crown or crowns by themselves, then you're looking at least a couple days because they actually have to make the crowns and seat them.
Right, and that includes the smile makeover too. If you're getting a full mouth, the crown's like a few days?
Yep, if you're coming for a smile makeover and you're not coming for any other procedures, you're just coming for dental, you're gonna be with us at least 5 to 6 days.
Oh,
We
wow.
don't usually Yeah, because we don't schedule anything on your arrival day.
Gotcha.
Um, it's like a quick maybe to come in and consult with the doctor prior, um, because we never know. We have our drivers, obviously, they're getting weight loss and plastics over
Mhm,
the 2. Weight loss and plastics have other appointments that they have to attend.
mhm,
So I try to make it easier on our drivers also by
mhm.
not having them have
Have
to
to
worry about getting a dental patient at a certain point in time.
That makes sense. And you know what? Like, I travel to Mexico pretty frequently, and I'm only a 45-minute ride away. But let me tell you, like, that first day with like stopping here, stopping there, checking in, you kind of just want that first day to kind of chill and like maybe just go grab some lunch or just check out your surroundings. So I think that's pretty wise, Vicky, that you do that. Um,
And
now,
I don't skip anything on departure days because
yeah.
obviously, again, you gotta make sure you're on the shuttle, you gotta make sure you're going across the border on
Mhm,
time. I'd rather not take the chance of scheduling you for dental in the morning, even if you're leaving in the afternoon,
mhm.
and taking the chance that your dental appointment runs behind or something gets messed up and then it throws off the rest of the schedule.
Yep,
So I try not to do that or departure days.
that makes sense. What about implants? Do they do implants, and is that a little bit trickier?
They do. Implants are a little bit trickier,
Mhm,
depending on what you're having done for implants. You're gonna still be with us for at least the same amount of days, 4 to 5 days, and that's because even placing the implants, they have to make you a temporary, so you don't go without teeth.
mhm,
Um, you have every implant procedure is at least 2 trips to Mexico, and they're 6 months apart. They
mm.
even who come in and they have to do bone grafting and place the implants, you have to heal for at least 6 months. Once you heal, you come back and you get your permanent crowns and the abutments put in.
Gotcha. I knew it was like a while in between, but I didn't know it was 6 months. That's pretty crazy. Um,
But we like to make sure that because 'cause you're screwing a titanium rod into your gums, so
um,
they wanna make sure that it adheres to your bone, it's
right.
sealed, it's not rocking, because 'cause you're gonna have these forever. You gotta make sure you have a stable chewing surface. So the
Uh,
longer that longer that rod has to settle into that bone and heal, that's, the better outcome for you in the long run.
that makes sense. So what about, like, the consultation process with you before they even come? What do you require? Do sometimes they need X-rays or that kind of thing?
So I require all patients, whether you're coming for a deep cleaning, a filling, a crown, implants, if you have a home dentist or even a home clinic
Mhm,
that you can get a full panoramic x-ray, which that's the x-ray they take of your full mouth, I recommend having that done and emailed to me prior to any type of dental.
mhm,
That way our dentist can review it. They can give you a diagnosis. They can give you every option available. Some people have more than one option.
mm,
Step. Those options could vary from a lot cheaper to really expensive. So it's nice to have 2 or 3 options in front of you and know financially where you fall before coming. And that way you can plan. So I always recommend, unless you're already in Mexico or close to the border and you can travel and have a in-person consultation,
mhm.
I recommend having that panoramic done and emailed to me.
That makes sense because, yeah, you might go in thinking you can have XYZ, and then you get there and they're like, "Well, no, you need A, B, C, D, E, F, G."
Yeah,
Like
there's a lot of people will tell me, "Oh, my teeth are not that bad, I just need fillings,"
yeah,
and then we get the X-ray and you have an abscess on your root, or your tooth is cracked, or you had a filling so many times that there's nothing left to really fill of the tooth once we remove it. You're
right.
gonna need and a lot of people don't understand dental,
Mhm,
it's not an easy thing to understand because dental is not very visual. If
mm.
you don't have an X-ray, you can't see what's going on beyond your looks.
Right, so
You
it's
need to
like an iceberg. You're only just kinda seeing the tip, you don't know what's going on underneath.
Yeah, people have infections and don't know they have infections, or,
Right.
there's people that have perio disease, and they just think, "Oh, I just need a really good cleaning." But
Mm,
then you go to your teeth, and your teeth start to loosen because you don't realize that the tartar and stuff that's holding your teeth there, once we remove it,
Mm.
there's nothing to hold it and make it stable.
Actually
So
holding
it's
it together. Wow.
great prior so we can see what's going on underneath those.
Right, because I heard that, like, a lot of health issues can actually come from your teeth and you don't even know it.
Yes, I mean, an infection in your mouth, it can go other places, and
Mm.
if it's not caught, it could become very serious. So it
Yeah.
is important. And if you think, my tooth's been bothering me for a couple of days,
Right.
it's a little bit painful. Go get an X-ray. You don't know what's going on. You
Yeah.
can't see it.
That is true, yeah. I say that as I'm like, "Oh, this tooth is a bit sensitive." Like, I
It's gonna
probably
start
need it.
bothering until
Right, I'm like, "I probably need a root canal," and I've just been putting it off and putting it off. I'm like, can it just be a filling?" Oh, I'm that girl. I'm like, "Can we just fill it instead?"
the opposite. I'm like, do the canal now. I don't care about the filling. Like, get it.
Really? Well,
Yeah. Yeah.
wow.
I, yeah, I'm the girl who never wanted Novocain. Like, if you could do my crown without Novocain, just do it. I don't like the Novocain process of it.
I don't either. I don't. For some reason, I get the jitters as soon as, like, they start putting like, my body uncontrollably shakes, and, like, I feel like the biggest wimp, but I'm like, "I can't control this. What's
Yeah.
going on?"
If I can have a filling done, if it's a front tooth and I could have a filling without Novocaine, or if I could do it, I'm gonna do it. I'm
Yeah.
always gonna choose Novocaine over Novocaine.
That's pretty brave. So let's talk about what is included because we're, a lot of people are very familiar with like the EOC packages. The transportation, the hotel, blah blah blah, companion. What is included for a dental patient when they get their consult back?
Well, with dental, only transportation isn't included.
Hmm.
Hotel is not. I still book the hotel for
Okay.
you. It's still our prices, which are $150 a night. You have transportation from the border to the border. All your appointments, that's all included. Just hotel is not included.
That's fair enough because I would imagine a couple of things. Number one, if it's just a day procedure, they might just pop back over and they might live in California, or a lot of the times they might be a companion, so they're already getting their accommodation with the patient, right?
Yep.
That that makes sense. Obviously medical tourism is a thing, and obviously we have, the best surgeons. That's what people come to us, but our pricing, Mexico's pricing is a lot cheaper than the US. So is that the same with the dental?
It is for some procedures.
Mhm.
So in some procedures, there is a difference, and I think it actually depends on where you are.
Mm,
Um, I notice that like a lot of patients, like if I post the price, they're like, "Oh, I could get it cheaper here," but it might be like a smaller town or smaller
mm,
state that's not versus like say Vegas or New York
mm,
or California. So I think the pricing really just depends on where you are.
mm.
Um, but I can tell you that here in New York, if you were to have full mouth implants, like an all on four procedure, it's close to $30,000. And
Mhm.
that's for all and lowers. In Mexico, with everything, you're probably looking at around 20,000. So
Yeah.
I mean that's a $10,000 difference.
It's
Um,
huge.
yeah. So I mean some people, and there are, I'm not gonna say that there's not other places that aren't cheaper in the States.
Mm,
Um, but cheaper is not always better. Not
that's
everybody, and you're talking about some people might not be as certified to place the implants.
yeah, that is true. I remember when
Yep.
Nicole got her quote in Vegas and she was ready to pull the trigger. She needed, the crowns and she needed two extractions and I think two bridges, and it was $48,000. And she called me. She's like, "Kayla, I've always wanted teeth. It's 48 grand. What do you reckon?" And I'm like, 48,000? Absolutely not. I'm like, "Nicole, this is your first consult. Like, shop around." And she's just like, "You reckon they want an answer now?" And I'm like, "No, don't do it. Like, shop
Now
around."
bridges, if you needed a bridge with us, I mean, if you're talking a 3 to 4 unit bridge, you're looking at around $1,600 versus here in the States. I mean, that's something that will cost around four to five thousand
Isn't
dollars.
that
So
crazy?
it's a big difference.
Yeah.
And a lot of people will say, "Oh, well, my insurance will pay." And that's the difference. So
Mm,
you have insurance that's going to cover a portion. So yes, your out-of-pocket might be cheaper at home, but that's because your insurance is also paying the other portion of it. So you have to
Exactly.
look at that. So
Exactly.
maybe in the States, it's $1,600 for a crown, but your insurance is gonna pay, 50% of that, and you're left with the other 50%.
Mhm.
For me, we're still cheaper than the 50%. We're
Exactly.
5 a crown, here, we're 8.25. So
It's mind-blowing. And
Mhm.
the work honestly is, like, better quality, I think, in Mexico.
Absolutely,
Yeah.
absolutely, and they're taking their time, and they're
Yep.
talking to you, and they're
Mhm.
showing you, and you have time. Like, I always tell patients, especially crowns and veneers, because people don't realize that you're used to looking at yourself in a certain way for so many years,
Mhm.
and put a brand new set of teeth in and you smile, you change, just like with weight loss and everything. You
Uh-huh.
don't recognize the person anymore, and some people are like, "Whoa,
Yeah.
I don't know how to handle this." So for me, I always say, if you don't like the way something looks or the way something feels, don't wait to get home.
Mhm.
Mention it while you're there. Let them fix it while you're
Yes.
there.
Yep.
Don't wait to get miles and miles away and then, email me and say, "I don't like this," because
Right.
I could do here except for make you have to go
Go
back
back.
there.
Yeah, so speak up
So
if you don't like it while you're there.
if you don't like something,
Mhm.
even if it's the smallest thing, this feels too bulky. This feels a little too long.
Mhm.
I don't feel like it's off when I smile. You have to remember too, you're cementing everything in place. It takes a little while for it to settle.
Yes.
So, and that's why I always recommend an extra day in there too,
Yep.
because go and see how you like them. And if something's not right, at least you have that day to go back and fix something.
Yeah, that is really true. I remember when, they put mine in and I was like, "Oof, I'm not loving this," and they're like, "That's fine, well, tell me what you want." Like, before they cement them all in, they're like, "Is this right?" And I'm like,
Oh, yeah.
"Nah, I don't think, can we fix this?" And they did, but again, you do need that extra time just in case. And, same thing with Nicole, she's very particular, so they went backwards and forwards with hers for a long time. But yeah, you could it's your face, it's your teeth, and they're gonna be there forever, so you make sure that they're right. And it's funny that you said that because, yeah, you do have to learn how to smile, like, all over again, and sometimes you gotta learn how to talk. Like, not that you have to learn how to talk, but I remember when I had the temporary and had that lisp for a bit, and I was like, "Oh my god, I got a lisp." But, like, things feel different, so it's like it's kinda like a whole learning process.
More bulky than your natural teeth because,
Mhm.
they do shave them down. It is a crown. It does full coverage. It might feel a little bit different than your
Uh-huh.
natural teeth. So it's gonna take, like you said, you're gonna have to learn to re-talk
Mhm.
or how to say certain words or practice, like, how you're gonna but yeah, it does happen, absolutely.
Yeah, and then I remember after mine, I'm like, "Well, I need bigger lips now because I got these, like, big white teeth." I was like, "Fill me up," So, but, everyone's different. But again, I think for me, doing teeth, if anyone's considering it, is, like, the best thing I've ever done. So if someone wants to get, a consultation, how do they contact you?
They can email me
Mhm.
at vicky@eliasortiz.co, not .com.
Alright, we'll
Um
write that up on the screen.
And just you can email if you already have a treatment plan from like your current dentist. Say you went to the dentist, they told you you need all these procedures and it's just out of your cost. You
Mm,
can email the procedure to me and I'll give you our cost, maybe just to compare it. You already had your consultation with your home dentist, you know what it's about. Send me your x-rays, send me your treatment plan that you already have. Let me send it to our dentist and see if they agree with the same thing
yeah,
and give you all the cost.
that's a good idea. A consult's free or
So a consultation is free. If you need to have x-rays, and certain exams are needed, especially for like implants,
Mhm,
they range from somewhere between like $70 to about $150. It's gonna depend on what x-rays you need.
mhm.
If you're covered with the x-rays, then that cost is usually 0.
Nice. And what's the turnaround time, from when someone, say, emails you until they get their consult back?
So that just it depends on the office itself.
Mhm.
It's usually pretty quick. If I turn it in on a Monday, usually about a week, sometimes even quicker. It just depends on what's going on in the office
Mhm.
and if the dentist, he does them like at the end of his day.
Mhm.
So depending on how busy his day is, there's times that I get them in 2 days, and it depends on what they are actually diagnosing.
True.
So, like, someone who has a treatment plan already laid out with the X-rays to look at, that might be something I get back in 2 days. Versus somebody who needs full mouth extractions with an implant, it might take a week. Sometimes it might take two. It just depends on what they have to look for.
Right. And is it Doctor Sergio? Is that his name?
Yes.
It
So he does like our they have specialists that rotate in all the time. They
Mhm.
have a root canal specialist, they have an implant specialist. Dr. Sergio, he does most of our crowns and veneers.
Mhm.
Um things. So once you're there, they will go over exactly who's going to be doing what procedure with
Mhm.
you.
Mhm.
But like I said, it depends on your treatment plan. And if you have multiple procedures, you might be seeing two different doctors.
Mhm. That makes sense. And you guys, they're so friendly and they're so gentle too. Because I'm usually like, I'm a little bit of a chicken when it comes to dentists. For surgeries, not really, but like dentists, I'm like, ooh, like I'm always so, ooh. But they're really, really just so pleasant and very gentle. I was like, I actually have never felt pain. Um, Even just sometimes cleanings hurt for me. Because I'm like, got a bit sensitive, like gums and stuff. But they're very gentle, so I highly recommend them.
As their cleanings, like, we have a lot of people who will just say, "Hey, I need a cleaning. It's been 6 months, 8 months. I can't get into my dentist. I'm gonna be there. Can I have a cleaning?" "Absolutely." And they're like, "That is, like, the best cleaning that I've had in such a long time." Like,
Yep.
so gentle and get right down to it, and
Yeah. And they're
people are
quick too.
fast. Yeah,
Yeah.
cleanings are quick.
Yeah, I usually go, I like when I'm there for work, I do all maintenance, but I always, try to do like maybe every second trip or so, I'll do a cleaning. But yeah, they're always just really gentle, very fast, so pleasant. Just like I feel like it's just the Mexican culture. Everyone is just so accommodating and just the
So
nicest,
nice and
yeah, the nicest people. Well,
like more yeah, less stressful.
Right, right, exactly. Well, thank you, Vicky, because we get questions a lot on the page like, "Oh, I didn't know you did dental," or if they do, they're like, "What?" And then I always see you chiming in, "Just email me." But it's so nice to put a face and a voice to the name, and I think it's to shine a bit of light on the dental because not
I
everybody.
always we don't have a Facebook for dental. And I'm like, no, you can email me. I have all the information you need. And I do try to put up, once in a while, I try to put up the new pricing, and we run promotions every now and then too.
Mhm,
Usually they should probably be having one out come December. They
mhm.
usually run it end of November, beginning of December. They usually do a good promotion on crowns or veneers, like a whole smile makeover.
Yeah.
So be looking out for that. That should be coming.
Nice. Yeah, because I always do see when you post those smile makeover, like, the specials that are going on, I'm like, "Damn, that's cheap." Because I haven't done my bottoms yet, and I was like, "I know I should go do my bottoms." Like, I always think about that.
It ends up being, like, a lot of the promotions they do, it ends up being, like, 1 or 2 crowns basically free with the way they do the cost.
Yeah.
So you beat that, especially if you're doing a full, makeover 8 to 10 teeth.
Exactly. I'm like, "Damn, I should, yeah, go back for me bottoms," but we shall see. But anyhow, you guys, this is Vicky, the dental coordinator. We're always tagging. So thank you so much, Vicky, for joining us. I know you're over on the East Coast, so it's getting a little late there and you got the kiddos. So I'll let you go. But thank you so much. And if you guys need or have any dental questions, just email Vicky at eliasortiz.co.com. All right. Thanks, Vicky.